family planning, like you've just said, it is very, very critical. We need to change mindsets. Another thing which you did mention is sometimes a lady or a woman doesn't want to have so many kids, but she, has to have three or four. What are your thoughts on the two-child norm? Do you think, how would that be for women in the country? Do you see it happening? Should it happen?
India doesn't need a two-child norm. And let me explain to you why we don't need a two-child norm. And then I'll explain why it's not going to be good for women. Fertility is declining very fast in India in much of the states. So 20 states already have replacement level fertility, which means that, the numbers will remain constant. We will not have an increase in numbers if we reach replacement level. Second, I want to say that in India, women and families don't wish to have more than two children. So women and families don't wish to have more than two children. What is the problem? The problem is lack of access to family planning services, and women don't have the authority, autonomy, or agency to decide. So we need to empower women. We need to give them access to temporary methods or any method that suits her at different periods of time, because women's bodily needs keep changing. And given their hormonal changes at different stages, which is adolescence, menopause, in the middle of having babies, the hormonal imbalance, or should we say hormonal changes, determine which family planning method will be most useful. Most countries have many more family planning methods than India. So if we provide temporary methods, women will not have to depend only on sterilization and have endless children in the meantime, or abortions. Second, women don't have autonomy and authority, as I have repeated 3 times, but it is important, so it keeps coming up in my narrative and conversation. So what it will do is, even those women who wish to have 2 children or 1 child, because they are forced to have a 3rd child, especially if they haven't had a son, or because nobody cares about family planning or their health. So is it not fair to women when they are the ones who don't have agency and they don't have access? So a 2-child norm will not work. And also in much of southern part of India, where women have access to family services, better access, and fewer children, why shouldn't we give the same access in UP, Bihar, Rajasthan, Assam, and all these states where fertility rates are high? If women were in school also, they would have fewer children. There is data in India to show that if a girl has studied class 12 and above, or only class 12, she's likely to have not more than 2 children. So why don't we, the best contraceptive is education. And education will also take them forward in their careers, in their economic growth, and the country. We keep saying there's this demographic dividend. This demographic dividend will become a disaster unless we invest in the literacy skills, etc., of our young people. So it's a win-win situation. Absolutely. And other states did not have a 2-child norm and coercive practices. In India, 20 states didn't have that. So why should we have anti-women policies? Women under the 2-child norm will not be able to stand for elections. Women will not get promotions. That's the kind of 2-child norm coercion and incentives and disincentives we are talking about in this country, which is not necessary. When there is a productive, constructive path, which is not harmful for women. And finally, Ambika, I want to say that when you enforce a 2-child norm, like they did in China, 1 child and 2 child, they had huge imbalance. They had fewer girls because girls were aborted or infanticide. And in India, even without having a 2-child norm, we have such poor sex ratios. We have fewer girls, especially in Haryana. The girls are being bought for marriage from Assam. We don't
Yeah.
want this situation.
Even further, yeah. And in fact, unfortunately, maximum girls, I mean, childhood, we talk about that as well. So it's a very, very, very difficult situation.